It's now 6 months that the world has been grappling with the deadly COVID-19 pandemic. The first case of coronavirus in Rwanda was confirmed slightly over 3 months ago. Lockdown and stay-home campaigns are some of the measures that have been adopted by governments across the world to control the spread of the virus. In Rwanda, at the peak of new infections, lockdown lasted for a month and a half. This has in one way or another resulted into anxiety among citizens, especially with the recent spike in new infections. I would be lying if I said we are not anxious about the possibility of reinstating the lockdown, especially with new reported infections.
I'm overstocking in anticipation of the second wave of coronavirus infections, which could lead to yet another lockdown.
I am worried that movement between the city of Kigali and provinces could be stopped again. On the other hand, some people say that COVID-19 restrictions should be adopted in consideration with the social and economic livelihood of citizenry. There are concerns of poverty. We should draw a line between COVID-19 control measures and the possibility of the high rate of unemployment as a result. Authorities need to examine these issues carefully.
Majority of the urban residents are living hand to mouth, many of them working multiple jobs in the informal sector to meet their daily needs. Another lockdown would greatly disrupt their livelihood and lead to hunger crisis.
Up until now, no one knows when coronavirus will disappear, not even the World Health Organization. Speaking at a briefing this Wednesday, World Health Organization Emergencies Director Dr. Mike Ryan warned against trying to predict when the virus would disappear. He said that even if the vaccine is found, controlling the virus would require a massive effort.
This virus may become just another endemic virus in our communities, and this virus may never go away. HIV has not gone away, but we've come to terms with the virus, and we have found the therapies and we've found the prevention methods, and people don't feel as scared as they did before, and we're offering life to people with HIV, long, healthy lives to people with HIV. And I'm not comparing the two diseases, but I think it is important that we're realistic, and I don't think anyone can predict when or if this disease will disappear.
Economic experts, based on the World Health Organization standpoint, to ask governments to carefully examine COVID-19 control measures. Lockdown has a cost to the nation and to individuals, because when people are not allowed to leave their homes, they will definitely need basic commodities, yet they will not be generating any income to meet their needs. It is difficult to compare the economic impact of coronavirus control measures and the impact it has on health. That's why I think economic activities should resume such that the country generates revenue while people are also able to meet their basic needs in consideration with COVID-19 control measures. Dr. Eyazar Ndabarura, an expert in epidemics, told Arabia that it is possible to live with the epidemic as long as people have relevant information relating to control measures. Having information is the most important thing. Other measures like lockdown can be adopted when necessary, but people need to know how to control the spread of the virus individually. Ensuring hygiene, social distancing, and wearing face masks. Mass testing is equally helpful. We cannot completely close everything in the country. Such measures need to be carefully examined in consideration with the economic activities of citizens. According to the figures from the Ministry of Health, new infection rates in Rwanda stand at 0.6%. while recovery rate is at 98%. As of June 18, 2020, Rwanda had registered 646 cases and 350 recoveries, while COVID-19 related deaths were 2. New cases in Rwanda are largely driven by Rusizi cluster and cross-border truck drivers.